Hi friends, now we are moving towards the third muscular layer of the soul, third and fourth muscular layer. So just read the names of the muscles. Third layer, it has got flexor hallucis brevis, adductor hallucis and flexor digiti minimi brevis. See, first muscle, flexor hallucis brevis. Flexor means it helps in some flexion. Hallucis means great toe, big toe. And brevis means it is a small muscle. So it is a small muscle associated with the great toe that helps in its flexion. The function endana flexor hallucis brevis inde? It helps in flexion of the big toe or great toe at the metatarsophalangeal joint. Now let me show you the picture of flexor hallucis brevis. You can see this muscle here, right? This muscle here that is attached to the big toe, right? This is a big toe. So this muscle that I have highlighted in white, okay? Yeah, so that is flexor hallucis brevis. Okay, this muscle, all of you. So now the next muscle, which is that adductor hallucis. Adductor hallucis, it helps in adduction of the hallucis means what? Great toe. So adductor hallucis, it helps in adduction of the great toe. So imagine this is the great toe. What is adduction, guys? Adduction and if I am bringing the great toe near to the second toe, your action adduction in the warrior. I am showing it in my palm. Okay, you imagine it in your foot. So adductor hallucis, let us see the picture of adductor hallucis. One second. Okay. This muscle, this is adductor hallucis. This is the oblique head. This is the transverse head. Okay, that is adductor hallucis. Now the next muscle is flexor digiti minimi brevis. Flexor digiti minimi brevis. Look here. This small muscle here, which is attached to the little toe. That's flexor digiti minimi brevis. Flexor means it helps in flexion. Digiti minimi means little toe. Brevis means it is a small muscle. So flexor digiti minimi brevis, it helps in the flexion of the little toe at the metatarsophalangeal joint. See, this metatarsophalangeal joint between the metatarsal and the phalanx. That is metatarsophalangeal joint. So, this flexion little toe is muscle very good. Flexor digiti minimi brevis. So, we learned about the muscles of the third layer of the soul. Third layer. Now moving on to the fourth layer. Fourth layer of the soul. We have got dorsal interossei. We have got interossei muscles in the fourth layer. Okay, interossei muscles. Dorsal interossei and plantar interossei and pinne rendu muscle tendons ninge fourth layer il kaanan pattum. Tibialis posterior tendon and peroneus longus tendon. This much clear? See, dorsal interossei, let me show you the picture. See these small muscles that you can see, okay? These are the interossei. Okay, we dorsal interossei and plantar interossei and see, palms we have learned about palmar interossei, dorsal interossei. Do you remember? Yes? So, see, let's revise that. Palms we palmar interossei and dorsal interossei. Palmar interossei helps in what function? Our code pad and dab. What is it? Pad and dab. I'll write it. I'm talking about the palm. We have pad and dab. Now tell me, pad and dab stands for what? Okay, so P in pad stands for palmar interossei. and AD stands for adduction of the fingers. So palmar introsci, in the palm, it helps in adduction of the fingers. And dorsal, D, dab, that is the next code, dab. D stands for dorsal introsci. ഇവിടെയാണ് dorsal introsci, and it helps in abduction of the fingers. It helps in abduction of the fingers. Now look here, what is adduction, what is abduction? See, if I bring all my fingers close to the middle finger, then adduction of the fingers nu paraya. If I am bringing or if I am moving all the fingers away from the middle finger, ഇതിനെയാണ് ഞാൻ abduction of the fingers എന്ന് പറയാം. Adduction of the fingers എന്നെ സഹായിക്കുന്ന മസിൽ ഏതാണ്? adduction, very good, palmar introsci. Abduction, dorsal introsci. This much clear? അപ്പോൾ അതേപോലെ തന്നെ നമ്മുടെ സോളിൽ നമുക്ക് പ്ലാന്റാർ ഇൻട്രോഷൈ ഉണ്ട് ആൻഡ് ഡോർസൽ ഇൻട്രോഷൈ ഉണ്ട്. ഓക്കെ, സോ പ്ലാന്റാർ ഇൻട്രോഷൈ ഇറ്റ് ഹെൽപ്സ് ഇൻ adduction of the toes, and dorsal introsci, those muscles, they help abduction of the toes. So yeah, you guys, let me take the PowerPoint. So you guys saw the introsci muscles. Okay, these kunyu muscles here, they are the introsci muscles, and namakku plantar and dorsal introsci and just remember that. And fourth layer la namakku we can see the tendons of two muscles. So this tendon is peroneus longus in the tendon കാണാൻ പറ്റും. അപ്പോൾ പെരോണിയസ് ലോങ്ങസ് മസിലിൻ്റെ ഫംഗ്ഷൻ എന്താണ്? പെരോണിയസ് ലോങ്ങസിൻ്റെ ഇറ്റ് ഹെൽപ്സ് ഇൻ ഇവേർഷൻ ഓഫ് ദ ഫുട്ട്. ഇവേർഷൻ്റെ അർത്ഥം എന്താണ്? ഇഫ് യു ആർ മൂവിങ് ദ സോൾ ഔട്ട്വേർഡ്, അപ്പോൾ ഇതാണ് ഫൂട്ട് എന്ന് വെച്ചോ, ഇങ്ങനെ മൂവ് ചെയ്യാണ് ഔട്ട്വേർഡ്. Okay, I hope you know the image of eversion of foot. So eversion of the foot, that is done by major muscle is peroneus longus. Peroneus longus plantar flexion at the ankle adinum help cheyyunnundu, but remember eversion of the foot. Tibialis posterior tendon also you can see in the fourth layer, tibialis posterior tendon. So tibialis posterior, what does it help in? Tibialis posterior, yes, that muscle, it is a major muscle that helps in inversion of the foot. Inversion, so you guys see the picture of inversion and eversion of the foot. So if you are bringing your sole, if you are moving your sole towards the body or inwards, okay, then that is called as inversion of the foot. See the picture. About inversion of the foot, it is done by the major muscle that is helping in it. The major muscle that is tibialis posterior. Tibialis posterior also helps in plantar flexion. Okay. So idana fourth layer, muscles and tendons. So we learned about the first layer, second layer, third layer, fourth layer muscles. We're talking about the sole of the foot. So that is it, guys. I'll see you all in the next class. Keep reading and drink lots of water. Stay healthy. Bye-bye.